Let me tell you about Harold. He was 67, retired, careful, and proud that he took his blood pressure pill every morning. Same chair, same breakfast, same little white tablet. Then one hot morning, he stood up from the kitchen table, took 3 steps, and the room tilted. He reached for the counter, missed it, and hit the floor. At the hospital, everyone talked about balance, age, and his heart. But the real clue was simpler. Harold had been taking the right medicine, but his body was no longer handling it the same way. That is the part many people over 50 never get told. Blood pressure pills can save your life. They can lower the risk of stroke, heart failure, kidney damage, and serious heart problems. But after 50, taking them blindly, without watching the signals your body is sending, can create problems that look like normal aging. Dizziness, weakness, swollen ankles, frequent urination, fatigue, muscle cramps. A blood test that suddenly shows kidney numbers moving in the wrong direction. And here is the danger. Most people do not connect those changes to their blood pressure plan. They just say, "I guess I'm getting older." My name is Dr. Michael Ellis. I am 87 years old, with more than 55 years of clinical experience. And today, I'm going to walk you through 7 doctor-backed things every adult over 50 should know if they take blood pressure pills. This is not about stopping your medication. Please do not stop, skip, double, or change any prescription without speaking to your doctor or pharmacist. This is about knowing what to watch for before a small problem becomes a fall, an emergency room visit, or a medication mistake. Stay with me until number 4, because that is where we talk about the dizziness mistake that causes many seniors to fall. And number 6 is the ankle swelling clue that gets misread all the time. Before we start, type BP in the comments if you or someone in your family takes blood pressure medicine. Also tell me your age. I read the comments because it helps me understand what this community is dealing with. All right, let's get into it. Before number 1, understand why age changes the conversation. At 35, the body usually has more reserve. If you get a little dehydrated or stand up too quickly, the system often corrects fast. After 50, and especially after 60, that safety margin can become smaller. The kidneys may filter differently, the thirst signal may be weaker, muscle mass may be lower. You may be taking more than one prescription. So the exact same pill that worked smoothly 5 years ago may feel stronger today. That does not mean the medication suddenly became bad. It means the plan should be treated like a living plan, not a stone tablet. Your doctor needs feedback from your real life, your readings, your symptoms, your falls, your swelling, your bathroom habits, and your energy. Number 1. Feeling fine does not mean your blood pressure is fine. This is the first misunderstanding. A person says, "Doctor, I feel normal. Why do I need this pill?" But high blood pressure often does not announce itself. It can quietly strain the arteries, heart, brain, kidneys, and eyes for years before a major symptom appears. Think of it like water pressure inside a pipe. The pipe may look normal from the outside, but if the pressure stays too high every day, the inner wall takes damage. That is why blood pressure medicine may be prescribed even when you feel perfectly healthy. The pill is not treating a feeling. It is treating a silent risk. But here is the other side. If you start feeling worse after a new medication or dose change, do not ignore it. Do not say, "Maybe this is just age." Say the exact words to your doctor. "Since starting this pill, I feel lightheaded in the morning. Since the dose increased, I feel weaker when I stand. Since adding the second pill, I get tired after breakfast." Those details matter. Your doctor cannot fix a pattern they never hear about. And please understand this. A side effect report is not disrespect. It does not mean you are refusing treatment. It means you are helping your doctor match the treatment to your real body, not just to a number on a chart. Number 2, one blood pressure reading can fool you. A single reading is a snapshot, not the whole movie. Your blood pressure can rise because you rushed to the clinic, drank coffee, slept badly, had pain, felt nervous, or climbed stairs before the cuff went on. It can drop after a hot shower, dehydration, alcohol, a missed meal, illness, or standing up too quickly. That is why one dramatic number should not send you into panic. What matters is the pattern. If you take blood pressure medicine, one of the smartest things you can do is keep a simple 7-day home log. Morning and evening. Same arm, Same position. Sit quietly for 5 minutes, feet flat, back supported, arm at heart level. Do not talk during the reading. Take 2 readings about 1 minute apart, then write down the time, the numbers, and any symptom. Dizzy after standing, skipped breakfast, very hot day, took pill late, swollen ankles by evening. That small note can change the entire appointment because your doctor is no longer guessing from one clinic reading. They can see how your body is living with the medication across real life. I have seen people panic over one high number at the clinic, then discover their home numbers were actually controlled. I have also seen the opposite. A person looks fine in the office, but their morning readings at home are too low and they feel weak before breakfast. The truth is in the pattern. Do not become obsessed and check every 10 minutes. That creates anxiety and confusing numbers. Just build a clear pattern. Number 3. Timing matters more than most people think. Many seniors take their blood pressure pill whenever they remember. Morning one day, noon the next, bedtime the next. Then they wonder why the readings jump around. For many medications, consistency helps. Taking your medicine at roughly the same time every day can make the effect steadier and easier to judge. But do not randomly change the timing because a friend, neighbor, or YouTube comment said bedtime worked better for them. Your best timing depends on the specific medication, your blood pressure pattern, your kidney function, your fall risk, and the other medicines you take. Also, do not split tablets unless your doctor or pharmacist says that exact tablet can be split. Some pills are designed to release slowly. Crushing or splitting the wrong one can change how the medicine enters your body. And if you miss a dose, do not automatically double the next one. That is how some people accidentally push their pressure too low. Here is the question to ask at your next visit. Based on my home readings and symptoms, what time should I take each blood pressure pill? And what should I do if I miss one? Simple question. Very powerful. If you use a pill box, still keep the bottle labels or a photo of them. A pill box tells you that you took something. The bottle tells your doctor exactly what it was, what dose it was, and who prescribed it. Number 4. Dizziness when standing is not something to brush off. This is the fall section I told you to stay for. If you are over 60 and you get lightheaded when you stand up, that is not automatically normal aging. Sometimes it is a sign that your blood pressure is dropping when your body changes position. In plain language, you stand up, gravity pulls blood downward, and for a few seconds your brain may not get the blood flow it needs. You may feel dizzy, weak, blurry, shaky, or close to fainting. Now picture when this often happens. 2 o'clock in the morning. You wake up to use the bathroom. You sit up fast. You stand fast. The room is dark. Your blood pressure drops. You take one step and lose balance. That is how a bathroom trip becomes a hip fracture. This does not automatically mean your blood pressure pill is wrong. It means the whole plan deserves review. The dose may be too strong at a certain time. You may be dehydrated. You may be taking a water pill. You may have added a sleep aid, pain medicine, or prostate medication that also affects balance or blood pressure. The key is not guessing. The key is reporting it clearly. Tell your doctor, I feel dizzy when I stand. Ask if your blood pressure should be checked sitting and standing. Ask whether any medication combination could be contributing. And tonight, use common sense. Sit at the edge of the bed before standing. Stand slowly. Keep a nightlight. Do not rush in the dark. If this one hit home, type "stand slow" in the comments. That phrase may protect someone watching this video. Number 5. Some blood pressure pills need blood test monitoring. Not all blood pressure medications work the same way. Diuretics, often called water pills, help remove extra salt and water. ACE inhibitors, such as lisinopril, and ARBs, such as Losartan, affect hormone systems that tighten blood vessels and influence fluid balance. Calcium channel blockers, such as Amlodipine, relax blood vessels. Beta blockers, such as metoprolol, slow the heart in certain patients. These medicines can be very helpful, but some can affect kidney function, potassium, sodium, or fluid balance. That does not mean they are bad. It means they need monitoring. For example, if a person starts a water pill and later feels weak, cramped, unusually thirsty, or confused, the issue may not be age. It may be dehydration or an electrolyte change. If a person starts or increases an ACE inhibitor or ARB, The doctor may want to check kidney function and potassium, especially if that person is older, diabetic, dehydrated, or already has kidney disease. Symptoms can be vague: muscle cramps, heart fluttering, unusual weakness, confusion, extreme fatigue, reduced urination. Those symptoms can come from many causes, but after a medication change, they deserve attention. Ask this at your appointment: do I need blood work to monitor my kidney function and electrolytes with this medication? That is not being difficult. That is being smart. And if your doctor already ordered blood work, do not ignore it because you feel fine. Some of the most important medication problems are quiet at first. The lab test may catch the issue before your body has to scream. Number 6. Swollen ankles may be a medication clue, not just aging. This is one of the most common complaints with certain blood pressure pills. A person starts amlodipine or a similar calcium channel blocker. A few weeks later, the ankles begin to puff up. At first, it is small. Sock marks get deeper. Shoes feel tighter. By evening, the feet look swollen. Many seniors immediately fear heart failure. Sometimes swelling can be serious and must be checked. But sometimes the swelling is related to how the medication relaxes blood vessels and allows fluid to collect in the lower legs. The timing is the clue. Did it start after a new pill? Did it get worse after a dose increase? Is it both ankles, mostly in the evening, and better after raising the legs? Tell your doctor the pattern. Do not just say, "My ankles swell." Say, "This started 2 weeks after my dose changed." That gives your doctor a useful clue. They may adjust the dose, change the medication, combine it differently, or check for another cause. And please remember the danger signs. If swelling comes with shortness of breath, chest pressure, sudden weight gain, one-sided leg swelling, redness, warmth, or severe pain, do not wait. Get medical help quickly. But if the swelling is gradual and began after a medication change, bring it up. Your ankles may be telling part of the story. This is also why adding another pill without understanding the cause can create confusion. If the swelling is medication-related, the answer is not always simply adding a water pill. Sometimes the answer is reviewing the original blood pressure plan. Number 7. Better numbers do not mean you are cured. This mistake is dangerous. Someone takes blood pressure pills for a few months. The numbers improve. Then they think, "Great, I don't need this anymore." But often, the number is better because the medication is working. Stopping suddenly can allow pressure to rise again. With some medicines, especially certain heart rate medicines, sudden stopping may create serious rebound problems. So do not stop on your own. But also do not stay silent forever. Your body changes, your weight changes, your diet changes, your kidney function changes, your activity changes. You may add pain pills, cold medicines, sleep aids, supplements, or new prescriptions. Any of those can change the safety of the plan. The safest mindset is not "take it forever and never ask," and it is not "stop when I feel better." The safest mindset is review, measure, adjust with guidance. Once or twice a year, ask your doctor or pharmacist to review every medication you take, not just the blood pressure pills, everything. Prescriptions, over-the-counter medicines, vitamins, sleep aids, pain relievers, and supplements. Bring your home log. Bring your symptom notes. Bring the actual bottles if you can. Then ask 3 questions. Is my blood pressure target still right for my age and health conditions? Could any of my symptoms be related to my medication? What should I do if I miss a dose? Those 3 questions can prevent confusion, falls, and dangerous self-adjusting. Let me close with this. Blood pressure medicine is not the enemy. High blood pressure is dangerous, and treatment can protect your brain, heart, kidneys, and blood vessels. But after 50, the smartest patient is not the one who silently swallows pills without understanding. The smartest patient is the one who pays attention. Pay attention to dizziness. Pay attention to swollen ankles. Pay attention to unusual fatigue. Pay attention to cramps, confusion, frequent urination, dehydration, and changes in your readings. Write things down. Ask better questions. Bring patterns, not panic. And never change medication because of fear from a video. Use this information to have a better conversation with your healthcare professional. Here is one final habit I wish every family used. Keep a small card beside the blood pressure monitor. Write the medication name, dose, time taken, prescribing doctor, and one question at the bottom. What changed recently? New dose, new pill, hot weather, stomach bug, missed meals, more urination, poor sleep. Those little details can turn confusion into clarity. If this helped you, share it with someone over 50 who takes blood pressure medicine. And in the comments, write the blood pressure pill you take if you feel comfortable sharing. Amlodipine, Losartan, lisinopril, metoprolol, hydrochlorothiazide, or something else. Your comment may help someone realize they are not alone. Subscribe for more plain language senior health education, and remember, do not fear your medicine, understand it.